Good afternoon, and thank you very, very much to the Institute of Medicine for this unbelievable invitation. It's wonderful to be here to find out about the work that you do, and also to have had this wonderful opportunity to be together with some of the other WeGo team members. We're a virtual organization. We are an organization, but we're all around the world. So actually having 6 of us in the same place is a great pleasure, and for a lot of strategic planning too. I'd like to ask you just to have 3 sort of, I'm going to say 3 knots to begin with, so I can put limits on myself. One is, don't see me here as a South African, despite my rather strange regional dialect. In WeGo, I'm director of the Social Protection Program. It's a worldwide program, and it's about our occupational health and safety project in 5 countries that I wish to speak. Secondly, that I'd like to keep it a separate discussion here, as far as possible and as realistic, from universal health coverage. This was an occupational health and safety project which rose from the ground, and it wasn't, the presentation is not located in terms of the bigger debate on universal health and coverage of my presentation, whereas Marty's was. And also to say that the stress is not particularly on public-private partnerships here. I'd like to tell you about a WeGo project which has been running for 4 years, funded partly by the Netherlands MDG3 Fund on women's empowerment, and partly by the Bill and Melinda Gates Innovation Fund. And to say that it came out of work that we were already doing in WeGo, in social protection, where we actually kept on looking at the larger national programs of health coverage and how much did they include or not informal workers and so on. And then we did a set of comparative value chain analysis studies of 2 countries working in horticulture and 2 countries working in the garment industry. And it became extremely clear how deeply important the place of work was, and what people do was and is. So the occupational sector and people's places of work, and that you get overwhelmed by the challenge of social protection for informal workers or any other policies for informal workers, unless you disaggregate and unless you break down. So we devised this project, which has been highly exciting, and which we are coming to the end of the first phase and considering now strategically where to go with it. I won't repeat the things that have already been said. I want to draw your attention to that 4th important bullet, which is the informal workers having little autonomy and control in the places where they work. In other words, the sidewalk, the public park, the private home, the construction site, waste dump, forests and fields. So there's a diversity in there. And although, of course, informal workers have more control over their own private homes, we're wanting to look at who controls aspects to do with the control of safety and health, say, of private home as a place of work. And just to say, I'd like to frame the comparison between OHS or OSH or SHE or whatnot. We just chose OHS and we've stuck with it. Michael Quinlan's very important framework about the archetype for industrial firms, for OHS in large firms with full-time employees, and the difference between that and what we're working with. It really helps to say where are the boundary lines. So you can run your eyes down at a known number of people on fixed premises that were designed for work and controlled by employers. That's very specific. OHS is part of the legal obligation of employers. There's an inspector with the norms, standards, and tools for identification of problems, clear paths of reporting injuries and diseases, appeal mechanisms for workers and employers, rules for compensation. And to say that, Yuka, with your presentation on the ILO programs, that these programs, from the perspective of the ground up with informal workers, can I say, they've been good programs, but the emphasis is on self-regulation. And that was in your own words yourself, that it's low cost, it's self-regulation. We're trying to look at programs that spread the responsibility further. So given Quinlan's framework, here's a self-employed traditional healer in Durban, and I ask, is he formal or is he informal? And the answer is he's in almost all respects formal. He pays rent for his site. The city council knows he's there. It's subject to health inspections. I don't think the city council likes the fact that in those plastic bags behind him, there'll be sort of snake skins and hedgehog vertebrae. I don't like that either, actually. It's subject to health inspections. He's a member of the new accredited association of traditional healers in South Africa. And his business is registered, and that's a kind of quasi-registration, and he doesn't keep accounts. He knows. He'll tell you what his turnover was last month, but he doesn't keep accounts. But in all other respects, he's formal, although he looks unusual, perhaps. And to contrast him with these wage workers in the construction industry in India, and the slide came from Seva, where women at the very bottom end of the construction industry worldwide, huge, well-recognized, and with workers at the bottom of it, whose work is highly precarious, highly risky, and who wouldn't have any form of a written contract at all. The forces of exclusion, we've talked, Marty spelt out the lack of recognition. We've talked a lot about the lack of reliable statistics in labour force surveys. And to say that in Laura's presentation just before lunch, she was emphasizing the disconnections in institutions within government at the local level, between different departments at local level. There's also a disconnect often within the health and the labour ministries between the national and the local level. So here's your national policy, here even your norms and standards, but something gets lost in the way to implementing it at local level. Some of the barriers to improved conditions of work. We've talked about the insufficient allocation of resources from government. It also depends, that's a decision, isn't it? It's a policy decision. How much are you going to allocate to different aspects of the health system? And OSH or OHS might be not get sufficient. But there is also the problem, as has been said, of something called political will. But there's also the problem of lack of coordination between departments, and that's not a costly thing to achieve. And I would say that's the important matter of political will, is whether there's some kind of mechanism in place which encourages different departments to work with each other. If on the part of employers, especially with disguised employment relationships, there's no responsibility for the informal places of work or conditions under which producers or service workers work. Lack of recognition by trade unions, and then informal workers themselves. And I think this is important to just draw attention to again. Income is a priority. Headload porters carry much too much greater weights on their necks, whether it's the women, the very slight women in Accra, or the big, bulky stevedores in Lima working in the port. They're carrying twice, thrice too heavy loads. There's very little incentive to invest to improve work conditions. The high turnover of workers may mean that employers resist, and I'm talking about informal employers, resist paying for the expensiveness of health screenings, and Laura Alphas has got an interesting paper on that up on the WeGo website. And the lack of information about the consequences of poor work practices. When I talk now, that the slide is intentionally blank, don't worry. When I talk now about the WeGo 4-year occupational health project, I need to say that it came from the ground up. It was extremely informed by the work experience of Seva and of HomeNet Thailand in particular. And I'd like to call it, it looks sort of loony in some respects. It looks too ambitious. But I'd like to say, please believe me when I say it's rather modest and even quite demure at times. We know that we are trying to understand more deeply what an extended occupational health and safety discipline could look like. So we chose 5 countries, and we chose them for difference. Yeah, very big or much smaller, much more informal sector work, much less. Better resources for OSH, almost no resources for OHS. And the approach was sectoral, as is the We Go Way, the standard We Go Way, because the possibilities for extension of something, a policy like, and a set of practices like occupational health and safety, is going to depend critically on the places where people work, because that also determines the ability of people to organize together, and just simply the risks faced in that work. It was quite urban-oriented, although we did have special studies of agricultural workers and the seaweed farmers in Zanzibar under fisheries. We wanted to understand better the risks faced by the workers, how to modify legal and institutional barriers to inclusion, look at the resource issues and find out how much is really resource shortage, or how much are decisions that are made that could be changed, or there could be improvements through better coordination. And then to work with organizations of informal workers in shaping focused demands for OHS interventions. And I think Laura gave a very good example of the kind of attention that's gone into that. It's not a 3-day training course or something. It's over and over again, trying to get, and it's both officials and workers, to get the right people in the same room with clear demands that are appropriate for those people, and also help build the in-country research and organization capacity in OHS. We've improved the collection of statistics. And then this thing that I'll come back to at the end is really attempting to build on the models that we've already heard, the modules for data collection on occupational health and safety for informal workers and labor force surveys. And I'd like to draw the attention here to Vilma's work, who's been our principal investigator in Salvador, in Bahia province in Brazil, who's in a class, may I say, you're in a class of your own with the way you manage. If you presented a barrier to do with data, how are you going to overcome that? And has got a paper for the project on ways of collecting data, even though they're not going to be perfect. And then this thing which we have not got to in a serious way yet, which is to actually look at curricular issues and look at integrating occupational health and safety into mainstream training institutions. So we've worked with partnerships. We've developed nice exercises on mobility mapping, risks and hazard analysis, obviously prioritizing, the workers prioritizing their problems. We've done special studies, and then I think have made good developments on what does institutional analysis and mapping mean in the field of OHS. Who controls, regulates, trains, and has resources for OHS? And the country comparisons have been absolutely extraordinary. It's not at all the case always that more money buys better resources. It's decisions about training, and it's decisions about, I didn't mean about training, I meant about who sits in which departments and how they coordinate with each other. We've specialized quite a bit at policy and national level dialogues, and then we'll continue to share best practices of national level policy changes, and a lot of the lessons come from 3 of the 5 countries in particular, and that is SEWA and KKPKP in India, from the Institute for Collective Health in Brazil, and from Ghana. You might ask, why isn't Thailand here and why isn't South Africa here? Thailand wasn't here because Thailand was also way ahead of the field. Punsap will speak now, and was running their own, even they're a WeGo affiliate, but running your own OHS hub, if you like. Moving towards some selected lessons, which I'll follow then just with some selected really important issues for here and for us to take away from what we've learned here. The sectoral approach really helps understand the challenges too and opportunities for inclusion of informal work. So it's endorsing for occupational health and safety field what we already do in WeGo. The domestic workers, for instance, can be relatively easily covered by unemployment insurance. That might or might not be a good thing, by the way, in terms of cost effectiveness, but you can reach them through employers much more easily than you could reach, for instance, home-based workers or possibly street vendors. We've talked already quite a bit about the importance of municipal infrastructure, and yet the global and international organizations are set up with the national government, national sovereign state, as the main unit for analysis. But it's missing actually the vital importance of what happens at local level in terms of infrastructural provision to the things that make a difference to the health of informal workers. The need for coherent, consistent, and supportive stance from local and national authorities. And can I just give an example very quickly? I'm extremely aware of time, John. Newspaper, 6 weeks ago, my Durban morning newspaper, left-hand side. Sorry. President promises there will be 700,000 new jobs created by the end of the year. I mean, this is poppycock. It's beyond levels, any level of realism whatsoever. It's been promised 5 years running. There's job loss going on because of all sorts of things. So that's what the president says. And then there's a photo of more than 100 bead workers being evicted from the pavement in Durban. They've been there for years. They aren't paying their license just at the moment because the municipality has reneged on the understanding between them that for $5 a month, what they'll get in return is the toilets cleaned once a day. There will be a removal of mealie leaves, which bring rats and all kinds of things. But here are 100 people who've created their own jobs, who are women from the rural areas who come in once a week to sell what they've made in the meantime. They haven't got a permanent place in the city. And you look and you just think, I just think there's a disconnect going on there. So the promise of jobs it's about employment with the wrong understanding of what we need. We've got to make employment in South Africa. I think that one of the extremely important, most exciting edges of the project has been the ergonomics, the material, the development of working equipment that we simply fed into what SEWA was already doing and what the Union of Waste Pickers in Pune in India was already doing. So that was us saying, what would you like support for? And they've done that. And we saw some of Mirai's photos. It's led to interesting negotiations between local level workers and the local authorities, and also these very interesting partnerships with the big institutes of design in India. And I think that work hopefully will continue. We've also seen the benefits of occupational health and safety integration into primary health care, but also the risks of losing the preventive component of occupational health and safety. And that's something that Punsap will speak to in a few minutes' time. So, final slide. Sectoral approach is important. The place of work as a central variable has been important. If we're going to look at ways of extending occupational health and safety as a discipline and as a practice, the focus on infrastructure at the local level, and I think we would continue in this project with focusing on extending and expanding existing offshore OHS rather than looking at additional programs. For instance, the ILO ones on Wish and Wand. I think we've got a different project going on there, and they can run side by side. Finally, I think that I take Peter's challenge very seriously, obviously, but how does this mix with universal health coverage? Why didn't I just take my finger to the public health service? And I do think that this project is very, very serious about wishing to continue exploring the possibility of continuing responsibility of the private sector for people who are working for them, even if indirectly. And I think you can get at some of that through supply chain work, through value chain analysis, or what we might call a labor benefit approach. But that I think that given the way that so many even very good health systems are constrained by lack of funding, we need to look at ways of securing the commitment directly from the owners. I don't know how else to put it. The owners of the bigger firms. There's no way that the global forces of externalization will be stopped. That's not going to happen. And there's also no way that all informal workers will be formalized. I think the ILO discussions for 2 years are extremely important, but it might touch a few % of the informal workforce over 10 years or so. And I think it's really important we would like to continue looking at and finding ways of going to scale on the model that's inherent in this particular project and continue the work on it. Thank you very much. Thank you.
Thank you. And I think I have to apologize because I didn't properly identify you as the director of the Social Protection Program of WeGo. So I want to correct the record. I was speaking from the wrong piece of paper. And